So welcome everyone. We're waiting for everyone to kind of move into the room. So we'll give it a minute. And in the meantime, while those who have joined, if you can access interpretation, you'll see a globe at the bottom of your screen. And there you'll be able to select either English or French. And if you do not want to hear the original audio, so if you don't want to hear my voice, you can mute original audio. We'll just give it a couple more minutes and then we're going to get started because we already have quite a few of you here. We're expecting quite a few today, which is really encouraging. I'll give it a minute more. Okay, for the sake of time, I'm just going to get started. So those that will join will have to catch up. Fortunately, we'll be recording this, so the recording will be available later. So welcome. This is the fifth webinar of the series. So some of you may have participated in the other sessions. Today, we'll be focusing on urban sanitation service delivery. My name is Laura Kohler. I'm from WaterAid UK, and I'll be hosting the session today. Before we get started, there are a few housekeeping items. You probably are familiar with most of these. The first I already mentioned, which is that we have interpretation in French and English available. So if you'd like to access that, please go to the bottom of your screen, click that globe, and select the language of your preference. And mute original audio. We ask that you keep muted except for during the Q&A, which we would love to hear your questions and comments, but related to the topic of today's session. Please use the chat. You can also use it to introduce yourself, but also use it if you are having any technical issues. One of our co-hosts will be able to help you through the chat. And then lastly, as I already mentioned, we'll be recording this session and it will be available afterwards on the Susanna webpage. So similar to the previous sessions, we will start with a short framing before we jump into two presentations. The two presenters will be representatives from Senegal and from Bangladesh, and they'll be speaking to what it means to put into practice or the implementation of services in a city and in a mega city context. But first, before we jump into that, I kind of want to give a little background about where this series is coming from. The initial framework, the ideas were tested at the first Global Sanitation Summit held in Nepal last June. It was co-hosted by UNICEF, WHO, and WaterAid with technical support from S&V and a number of other sector partners. It brought country delegates from over 20 countries to share their efforts to provide safely managed sanitation services. They discussed common as well as context-specific challenges and came up with action plans at the close of that summit. And since the learning was limited to those that were present at the summit, it was agreed that it would be worth opening up this peer sharing and learning to the wider sector. So that's why we're here. And if you are interested, you can still get a taste of what came out of the summit by watching the videos. You can see the images here on this slide, and that information is available also through the webpage. So anyways, that is why we're here. And as I mentioned, this and the previous recordings from other sessions are available on Susanna. So why these steps to safely manage sanitation? Well, we know that we need to dramatically accelerate progress on sanitation, and that better sector alignment and coordination is needed more than ever to achieve this acceleration. And at the same time, we know there are still major gaps in understanding about what is safely managed sanitation, what is climate resilient sanitation, and how do we integrate safely managed sanitation into, for example, national policies, plans, regulations, standards, etc. The framework isn't something new, but it was designed as a short checklist to help demystify these questions and navigate through existing guidelines and tools that are out there. So it acts as a guide. I'm not going to go through the individual steps of the framework because of time, and hopefully you've been able to join other sessions. And you can see the graphic here on this slide. But if you do go to the Susanna webpage, you can access the actual step document as well as, again, listen in on previous sessions. But what I mentioned today is today we'll be focusing on urban sanitation service delivery. And what I think is important here is that many of these previous steps are relevant in the urban context. So we're adding kind of the systems, the services, but policy, regulation present themselves to be able to accelerate service delivery in these city contexts. So with that, I am going to turn it over to our framing presenter, Lungi Zuma, who is a utility partnership senior advisor with WaterAid and previously was with Winnie, directly implementing citywide inclusive sanitation in Durban. So with that, I'm going to turn it over to you, Lungi.
Great. Thank you very much, Laura. Good day, everyone. Mentioned, my name is Lungi. I work for WaterAid. I'm based in our Southern Africa regional office in Pretoria in South Africa. And I will be doing the framing presentation for this morning's session. So we all know that there's been rapid rise in the urban population. Data from 2023 estimates that just over 4.5 billion people in the world live in urban areas. And of those people in the urban areas, there's a high percentage of them living in informal settlements, which are characterized by very poor living conditions, including very low levels of safely managed sanitation services. And to be counted as safely managed sanitation, we require those sanitation facilities to be improved, not shared with others, and also that they prevent discharge of wastewater and fecal sludge into the environment. And we also need them to ensure that excreta is either treated or disposed of in situ or transported to be treated off-site. But when it comes to progress to safely managed sanitation, we need to accelerate the progress that we have been seeing. There's still a very high number of people who are using basic, limited, unimproved sanitation, and a fair number of people around the urban areas who are still practicing open defecation. The graphs on the right-hand side also show the status of safely managed sanitation varies between countries, between regions, and within cities of individual countries. Next slide, please. So the urban context is unique and presents us with a number of challenges to be able to provide these safely managed services. Some of the challenges include the density of housing, especially in informal settlements. We see very large investments being made, but not being used to their potential or being used for a number of years and then that not being sustained. We also see a diversity of containments, most of them which are not built to any standard, which makes it a bit more difficult to then manage the excreta safely further down the chain. And then, of course, the plight of sanitation workers, especially in the informal sector, who are still doing most of the work when it comes to non-sewage sanitation, but often lack the support that's needed to do the work safely. Next slide, please. So based on these unique characteristics of the urban context, some of the challenges to provision of safely managed sanitation, we have seen very inadequate or sporadic investments which are not made with the full city in mind or with the, a 25-year plan, 30-year plan in mind. We are still leaving people behind. So those investments are not targeted at the city as a whole. We're also seeing behavior change interventions, which are once off, and then they don't lead to the long-term change that we desire. In major parts of urban areas, non-sewage sanitation is left entirely to the household to manage throughout the chain. And there's also minimal coordination between responsible authorities. Next, please. But if we recognize that sanitation is a public good and that benefits are not realized until everyone has access, so what we mean by citywide access is that there's services along the sanitation value chain, including sewage and non-sewage. We also mean reaching all social classes of the city, and then also reaching all spatial parts of the city. And this suggests that unless all have access to toilets and proper management of the fecal waste, then the public health benefits of this service are not realized, and we still will get fecal waste polluting the environment. Next, please, Laura. If you can click, yeah. So if we look at the fecal sludge management chain, usually at the containment level, that is the household responsibility. But as we move through the chain, the responsible authorities, there can be various iterations. So there isn't a one size fits all. So for example, if there is a household using a pit latrine, that in most cities that is usually emptied and transported by small and medium enterprises, so the informal or the private sector. It could, though that fecal waste could then be delivered to an fecal sludge treatment plant that's either run by the national utility or run also by the private sector in some cases. And the reuse of that treated fecal waste can be done in agriculture. So again, moving back into the private sector. And then added to that dimension is factors like policy, standards, regulation, a big one now, which is finance, data, looking at how do we collect good data across the chain that will enable our decision making to be based on what is happening on the ground. And also importantly, looking at innovation. So how can we do things differently, not only on a technology side, but also looking at the different service models and business models that we use. Next, please. So how do we organize all these role players, all these interdependencies into an approach that can assist us in achieving safely managed sanitation at scale? So the City-Wide Inclusive Sanitation Framework, CWISE, is one of those approaches that can be applied in the city landscape. So the framework is used for the public service approach, where we're looking at everyone receiving equitable, adequate, and affordable sanitation services. Also, CWISE means using sewage and non-sewage mix across the entire value chain. Again, looking at achieving safe and sustainable service outcomes. And CWISE brings together the problem solvers to use data and evidence to leverage this very scarce resource that we usually see when it comes to sanitation service provision. Next, please. So the CWISE framework looks at the core public system functions like responsibility. So what are the mandates? Who is responsible at each stage of the sanitation chain? And added to that, accountability. So how do we ensure that there are clear performance objectives? There's rigorous monitoring of the performance of the chain, and also what are the consequences, either negative or positive, that come from that performance of our mandated authorities. And then looking at the function of resource planning and management, how do we use these limited resources to effectively manage and execute the mandates across the time and space? And if we do this, then we expect the positive outcomes of the sanitation service of equity, so reaching everyone with fair pricing, service quality, also an outcome of safety for our customers, the sanitation workers, communities, and also very importantly, sustainability, how then ensuring that the service is reliable and delivered continually to our customers. Next, please, Laura. And then the journey of scaling is not a one giant step from where we are to where we want to be. So incremental steps need to be taken along the way, where we learn from what other cities are doing within the country context, and adapting those learnings to fit the different contexts. And then along the way, asking the questions of, again, who is responsible, who is supporting, what investments need to be made as we move from citywide inclusive sanitation and ultimately to nationwide urban sanitation. Thank you.
Thank you, Lungi. So with that, we're going to move into two presentations, starting with Monsieur Mouhamadou Gueye, who is the on-site sanitation with the on-site sanitation promotion cell with ONAS in Senegal, who will be talking about CWISE in general, but also more specifically the business models, financial flows used to achieve inclusive sanitation services in Dhaka. Mr. Mouhamadou Gueye, are you online?
Yes, I'm online. I'm online, Laura.
Perfect. Yes, over to you.
I'm fine, and you?
Good.
Good.
Over to you.
Okay, thank you very much, everybody. My name is Mouhamadou Gueye. I'm working in National Sanitation Office of Senegal. I would like to do a presentation relating to these topics. And if you see in Senegal, we have the basic access rate in urban sanitation is 88.9%, and the basic access rate in rural areas is 62%. Okay, and the basic access rate in Senegal is 74%, and from the 74%, 61% with non-shared toilet. Okay, 74% is with shared toilet. Relating to the policy fitting of sanitation, we have in the ministry level the sectorial development policy letter from 2016 to 2025. Every 10 years, we design this policy letter, sectorial development policy letter for water and sanitation. It's both for water and sanitation. It is the current reference framework in the water and sanitation. The aim of this this policy letter is to contribute to the achievement to sustainable development objective.
Yeah, perfect.
Sorry, I had gone for an English version, but I'm going to speak in French. So the objective is to achieve sustainable development, to guarantee by 2030 that we have universal access to drinking water and sanitation while integrating integrated water resources management, so which is the IWRM. Just slide, please. Next slide, please. So this is the financial flows as requested in the terms of references of this webinar. So the financial flows for sanitation includes, since 2017 between 2017 and 2023, you will see that the government investment has increased of 134% of the state budgets, which is not, which is quite significant, which shows that the Senegal government has a level of commitment for the wash sector. So this political interest is already existing to develop the wash sector. And this has been manifested by the fact that the state has invested by increasing its investment of up to 134%. And what we can learn from this is that sanitation, water and sanitation need to be a priority for the state first, because the states actually the state counterpart is 41%, while the partner counterpart is 59%. Actually, we wish we could have a 50-50. And across the world, it's about 85% for water, which is funded by governments. And this shows that these are core sectors, and the costs need to be affordable for the communities. So water and sanitation are basic sectors for the population. And I'll confess that in some countries, the increase of water prices has created riots. And there could be a crisis in a country if the cost of water and sanitation services are not affordable to the population. Let me now move to the delivery model of the sanitation service. So we have ONAS, which is the regulation body, because we don't have a regulation body in Senegal. So the Office National d'Assainissement de Senegal is in charge of regulation, awaiting the establishment of a regulatory body. So it's a regulation by contract. So we have 10 processing tanks, units which are managed by the private sector. So there is a contract with key performance indicators that are evaluated by owners. At the ministry level, we also have a framework which is called the performance contract, which is an annual contract signed between the Ministry of Water and Sanitation and owners and the Ministry of Finance. So the umbrella, the line ministry is the Ministry of Water and Sanitation, and we also have the Ministry of Finance that's share the performance objectives and the performance contract between the states and owners. And we are currently under the contract for 2025-2028. So owners is the regulatory body as well as the water and sanitation regulatory body, because we don't yet have it in Senegal. And they're playing a key role because we have delegated the running of 4 of the processing plants in Senegal. And given the achievements, because we started actually with a pilot, and with the satisfactory results, we have added 3 regions to the delegation contracts. So for the fecal sludge management plants, they are delegated to the private sector. And these allow us to monitor the interests of the beneficiaries and the users, because there would be a kind of competition between the service providers. We have 6 delegatory bodies. But so for sanitation, we will have many more delegatory contracts. And the private sector is the one managing the marketing service together with owners. So owners is doing their own communication and marketing, and the private sector is also doing their own. And this allows the contractor to give more value to their service. I need to also mention the processor, because we have this funding from the Bill and Melinda Gates Foundation that gave us money in 2015 to do the test. And from 2020, we started the scaling up to use the fecal sludge byproducts in agriculture. We also have households, and owners is the one providing the service to households, and they do evaluate the quality of those services every 2 years, because this is an performance indicator in the performance contract between the state of Senegal and owners. And so we do assess the user satisfaction every 2 years. Okay, this slide is about the institutional management. So we have the Ministry of Water and Sanitation, which with public partners as well as private sector partners and civil society organizations. And several documents were developed, including the National Strategy for Development, and we have the National Liquid Sanitation Strategy, which goes up to 2030. We also have the sanitation codes. We have the environment codes, the property codes, and we also have the law on public water and sanitation service, etc. Besides, we also have standards that we try to apply, like the LSS, the standards which is about the management of wastewater. So we have a processing plants for gray water as well as for fecal sludge. And we do actually monitor the water qualities through those trends. We also have the national, the service that is responsible for the wash services quality, and we have the standards 074 that was developed in 2021, and owners also have other projects to establish other standards. Now, talking about the qualitative and quantitative results of this program, we have several projects that were implemented since 2020, and given the results of the pilot phase, we received grants from the Gueye Foundation between 2011 and 2020, and we have used almost 307 million USD to use that with partners like the Agence Française de Développement to receive a grant of.
We also have
25%.
Bill and Melinda Gates Foundation with the replacement of cesspool MTS, and this is for the blending finance. We use the mixed finance with 40%, 50% subsidy, and then 10% by cesspool MTS to buy those trucks. We are replacing 40 cesspool trucks, and we want to replace the 300 cesspool MTS and so on. This funding mechanism is very innovative because it has been agreed, $1 million grant aid, and we mobilized $1 million next to the government of Senegal, and next to the national BNDE, we mobilized $2 million. That means then the African Development Bank also, they have some project with World Bank and Bill and Melinda Gates Foundation. This is in a nutshell. We have with $13 billion that have been raised as a grant with Bill and Melinda Gates from 2011 to 2020, we could mobilize $307 billion. That means the ripple effect of that, which we benefited through mixed funding, blended funding. And as for the challenges that we have, anyway, owners must focus on the future to become company for the knowledge of heritage. We tried it already and it works very well. Now the lack of regulation of this sector I talked about, and also the issue of coverage of operation costs of the sanitation sector, which are covered only by 60% of the income generated, means there is a financial imbalance in the sector. Also, the delegation of all the value chain of the sanitation sector, which is planned, as well as the lack of regulation decree for the mechanical, cesspool emptying, and also we would like to delegate all the Senegal waste treatment plant. As for call for action, we think that the water sector benefits much more from investment in Senegal. Therefore, we need to make sure that the sanitation sector can also benefit from it to avoid the high trend, suburban trend. As you know, that is the sanitation that can have to catch up the highway trend that benefits from much more sector, means the water sector. Whereas sanitation become the necessary outfall for the water sector, because all water used in the house when become wastewater, and then if you don't invest both in water and sanitation sector, there will be some issues. Well, we have to try also to see which is the best regulation system under the contract, and this enable us what is also the best way for funding way, from the government partners or private sector, or combine the three of them. Therefore, I thank you very much for your attention. I plan to have a video shown. I don't know if we'll have time to. Thank you for your attention.
Yeah, so I think what we'll do is I'll share the link to the video in the chat, and if we do have time during the Q&A, we can pull it up again. But that way everyone can take a look. It's a 4-minute video, quite nice, summarizing a lot of the efforts in Dakar. But for now, we'll move to our next presenter because of time, and hopefully we'll be able to have some time during the Q&A. So I'm going to skip that for now. So now I'm going to turn the floor over to Engineer Anwar Satter, who is the Superintending Engineer and CWI's focal person within the Dhaka Water and Sewerage Authority. And he'll be speaking to a number of things, including the mix from non-sewered to sewered solutions that are needed to serve Dakar City. So over to you, Anwar.
Thank you very much. Yes, I am Mr. Anwar Satter. Already you know, I am working as City-Wide Inclusive Sanitation focal person at Dhaka Water Supply and Sewerage Authority. So I am now presenting mainly Dhaka condition, but for those who are very much new to know about Bangladesh, I will present 2 slides briefly about Bangladesh scenario, then go to my assignment Dhaka case, and especially how in Dhaka we implemented sewered and non-sewered, following sewered and non-sewered approach. Next slide, please. So, sanitation status in Bangladesh, you see, approximately 71% households, they directly or indirectly connects discharge to the drains or water bodies. So it goes to the environment, and especially 90% in slums. And you know, there are many slums in Bangladesh, especially in city areas, where it is very tough to establish any sewage networks, so it very often discharges to the environment. And another key issue and challenge, that is existing sanitation system is not being to cope up with the increased population density, because you know, Bangladesh is a densely populated country, and population is increasing very quickly, so it is tough to follow the population increment. And next is another one challenge. In Bangladesh, normally everybody use septic tank and soak wells, but in city like Dhaka, it is highly dense city and compact soil. Due to this, this soak well is not working, and the houses are adjacent to one another. So it is a challenge for us to use septic tank along with soak well. And you can see the slum area in the bottom presentation. The unimproved sanitation is 80%. So and open defecation is 11.9%. So it very often goes to the water bodies. Next slide, please. I previously said in Bangladesh it is mostly used septic tank, but sometimes it use soak pits. Somebody don't, and they discharge it to storm sewer or drains. And sometimes some of the houses they directly discharge to the storm sewer drains. This is the on-site sanitation usually they do. And the collection, mechanical collection is very less. Some vacuum tanker we use to collect the slush or septage, but it is very small in quantity. In most of the cases, it is done by manual collection, and some through drain. And transportation, usually the vacuum tank transported to treatment facility or any lowland. And in municipal storm sewer drain is now converted to the collection transportation network for some human excreta. And for the treatment, it is used only the lowland in most of the cases, but in Dhaka case, 20% is treated through STPs. This is the only off-site, I can say, treatment system in Bangladesh, you can say. And in other cities, Chittagong and Khulna, there are some treatment plant under construction, but not yet completed. And disposal and end use, it is also in lowlands, lake or canals or rivers, only single treatment facilities in Dhaka, that is an incineration plant at a sewage treatment plant. Next slide, please. Now I shall come to my case at Dhaka, and you know, this is the capital city of Bangladesh, and approximately 20 million people is there. And in core Dhaka, where the density is high, approximately 34,000 people per square kilometer, and fecal sludge management case load is approximately 3 million kg per day. And some other issues I can add here. There are 500 MLD wastewater is treated in Dhaka by 2 STPs. One is Dashargandhi STP, another in Pagla STP, that is operated under Dhaka Water Supply and Sewerage Authority. And only sludge management plant I have told earlier, that is in Dashargandhi STP. This is the summary of Dhaka scenario. Next. And previously in Dhaka, it was considered a traditional approach, and the master plan was just on the centralized sewer system only. And early we thought we can cover the whole Dhaka city with sewers, and on-site not considered properly, and the financed by central government loans only, and wealthy and business districts were prioritized, and limited coverage, and there were O&M challenges due to lack of resources, and resource recovery was not considered, and performance management was very weak. Now, after we introduced the sewage approach here in Dhaka, we converted it to safe, sustainable, and inclusive sanitation services, and we ensured equitable sanitation services benefit for everyone. Fecal waste is safely managed, and resource recovery is considered now, and diverse and innovative technologies we are introducing here in sewered and non-sewered, and some long-term planning we are doing, and we are discussing with the political people and leaderships. So recently this helps us a lot. Next slide, please. And we are actually introducing, there are many type of schemes here, not a single approach. As earlier I said, once we thought it will be centralized sewage system with sewers will be the solution in Dhaka, but we have seen that it is not possible to cover all the city, because there are some hard to reach areas, some slums, and many other things. So we introduced different types of scheme. The one scheme is centralized sewage treatment system connected with sewers, and another is centralized sewage treatment system connected with decentralized treatment units. Another is centralized sewage system that promoting scheduled discharging scheme. Another one is at-source sanitation transformative technology, and the last one is special arrangement for low-income community or in slums. These are the schemes. I will show some of the practical examples in the next slides. Next slide, please. This is the example of sewage sanitation. Dhaka WASA has a master plan. They have prepared a master plan in 2013. At that time, sewage approach was not on board, and the master plan was mainly considered on sewage sanitation, and there were 12 catchments, but due to some changes, now we are just developing new sewage master plan. We are updating this. So I can say in central Dhaka or core Dhaka, what I say, where the population density is high, there are 5 catchments. One is Pagla, another one is Dashargandhi, Rayad Bazar, Uttara, and Mirpur. 2 are on board already. One is Dashargandhi STP, that is under operation from 2022, and Another one is Pagla catchment. For Pagla catchment, there is a ancient sewage treatment plant, but we are reconstructing it and developing it, and it is under construction now. The other three is under consideration, and land acquisition and other activities are going on. And the most important thing is in all the sewage treatment plants, there shall be septage or fecal sludge receiving facilities, so that we can facilitate the co-treatment for fecal sludge treatment. Next slide, please. And these are some pictures of use of transport technology, and some are in Dhaka and some are not in Dhaka. And the one is community-based wastewater treatment. This is at Rajshahi. This is not in Dhaka. And another one is Nirbhara protect city water body from fecal contamination. This is nature-based solution. This is at Coral Slum in Dhaka, the biggest slum in Bangladesh. And another one is wastewater treatment and reuse for green city zones in Gulshan Lake. It is also in Dhaka. And another one is cluster sewer and wastewater treatment at Khulna city slum area. And these are the successful implementation of transformative technologies, and we are trying to scale up all these technologies where applicable in Dhaka. Next slide, please. This is the Coral Slum, the largest slum. Near about 1 million people lives there. And this is the Nirbhara treatment system. You can see early the lake was polluted, and after implementation of Nirbhara treatment system, the effluent is clear and the lake becomes clear. And the treatment facility turning to children playing place also for the slum people. And it connects 1,000 households. Next slide, please. And another approach we recently done with the help of UNICEF, along with Asian Institute of Technology and Bill and Melinda Gates Foundation, that in Dhaka city, as it is a densely populated area, availability of land is very low. So it is tough to establish STPs, sewage treatment plants and fecal sludge treatment plants in different places. It is very tough to get lands. And this is a practical example of stakeholder coordination also. Dhaka Water Supply and Sewerage Authority, they are actually doing sewage sanitation, and for fecal sludge management, according to recent institutional regulatory framework from the government, the responsibility lies on city authority, that is Dhaka City Corporation. And both the authority, we sat together, we just discussed among us, and we have signed a MOU so that the city authority will collect the fecal sludge from the households or from the containment, and they transport it to Dhaka Water treatment facility, and Dhaka Water is treating the sewage sludge, and they will just now treat both the sewage sludge and fecal sludge. So this is the best example I can say in Dhaka city that we have done recently. Next slide, please.
Less than 1 minute.
We have measured 6 steps we have taken in consideration to protect environment. One I have already discussed, DNCs and DWASA, we signed an MOU, and we are trying to update the revision of Bangladesh National Building Code. And for nature-based solution, number 3, nature-based solution, we are trying to scale up it more. And reclamation of water, we are trying to do it. And decarbonization, we are trying to do it. And scheduled discharging, we are going to implement it in major divisional city. Next slide, please. And this is the Dhaka Sewage Master Plan in 2013. This updatation is required because sewage approach is on board now. We are trying to update it as Sewage Master Plan. Sewage Master, update of Sewage Master, it will convert to Sewage Master Plan, I hope. So next slide, please. And this is the recap and what the lessons learned. Multiple sanitation schemes are required to address megacities, especially cities like Dhaka, densely populated, scheduled dislodging, sanitation transformative technology, etc. And co-treatment facilities found viable for highly densely cities because land availability is less. And stakeholders' formal coordination can solve sewage issues. And another thing is appropriate strategy and policy is must, and there are some policies, and we are going to take more policies to solve all the issues. Thank you very much. Next slide, please.
Thank you.
Thank you very much for listening me.
Great. So we do have probably less than we had planned, but we have a couple minutes for some questions. Do we have maybe 1 to 2 questions from participants? And also please feel free to put your questions in the chat and have some Q&A there as well. But any questions from the floor? If you do, raise your hand. You get a lot of applause. That's great to see. Do you have any questions? Rajiv, are there any in the chat at the moment?
There are 3 questions for Mouhamadou. One is regarding like explanation for fluctuation, financial fluctuation between 2018 and 2020. The other question is on like what percentage of the fecal sludge management process is covered from end-use product. And the third question from Mouhamadou is like, what is the funding mechanism or strategy to ensure sustainability of operation of ONAS? So these are 3 questions for Mouhamadou. Then we have 1 question for Lungi, requested to share any case studies or what type of studies needs to be conducted in order to implement CYs in African city. And there's 1 question for Anwar. What nature-based solution options are being tested in considering the land constraint availability in Dhaka?
Okay, why don't we start with those? And then I did see 1 hand. But Mouhamadou, I know that's 3 questions, but if you can give a quick response. If you need Rajiv to repeat them.
Many thanks for the participant for the quality of this question.
Thank you to participants for the quality of the question. Thank you. Sorry, General, I just go into English, then let's put it in French. Well, I would like to thank the participants for the quality of their questions. And the explanation of the budget increase is that, you know, the government of Senegal be the national company for the operation of our CNO, which is in charge of exploitation, or the national one company in charge of the management of the heritage, or SONES, which is CNO, which is in charge of operation of the body. We have some performance contract that have been signed with the government of Senegal, and the heritage company, that is the National Water Company of Senegal, SONES, and also the CNO that is in charge of operation of the water facilities. In the sanitation sector, we also have ONAS, which is in charge of heritage and operation. And, you know, in those performance contracts, we always have some engagement in terms of investment to be made. And we could see that in the water sector, there is an increase of 100,000 cubic meter of the potable water production from Gueye, located 200 kilometers from Dhaka city capital. We have also water desalination plant that has been put in place, and which for the first phase will produce 50,000 cubic meter per day for Dhaka region. Well, only for this demand and also the demographic growth, Dhaka have a demographic growth of 2.8% and also growing urban planning. We needed to provide support for this demographic boom with the water service provision in good quantity and quality. Only for the fact of building a 100,000 cubic meter day wastewater treatment plant and water desalination plant of 50,000 cubic meter per day are the reason of this budget increase by the government in the water and sanitation sector of 184% as percentage between 2013 and 2023, between 2017 and 2023, when only that is the justification rationale of this. Now, as for the other question, dealing with the issue between dealing with the fecal sludge treatment plant, in Senegal, we have many sludge treatment plant and wastewater treatment plant. We have around 15 of wastewater treatment plant distributed in the various regions of Senegal and around 15 fecal sludge treatment plant. And many of those stations are very close to each other. Therefore, it is easier for having the wastewater treatment plant is the natural outflow of the fecal sludge treatment plant because the effluent from the fecal sludge treatment plant, even though managed by private sector, and that wastewater treatment plant are under public sector, means on us, there is customer and supplier relation between the two, so much so that for those water treated by the fecal sludge treatment plant, it is made, they are distributed through the wastewater treatment plant, which enables, because we have a quality control by the owners laboratory. We have also a Senegalese standardization organization which we are working with, and we define standard to enable controlling the quality of wastewater and also the whole value chain of the sanitation system, for the collection in the septic tank to the treatment in the wastewater treatment plant. Therefore, it's collective sanitation, and since the collection from the piping, wastewater treatment piping, and also with the wastewater treatment plant, really the environment enables providing a safe sanitation service with appropriate treatment in enough quantity with quality does already exist at the institutional level. Now, for the third question, can you repeat the question? Because I think it was about the strategy. Laura, what was the third question? Can you mind repeating the third question? I didn't get it properly, please.
Rajiv, can you quickly repeat it?
Banji.
One question was on funding mechanism or strategy to ensure sustainability operation of ONAS.
Very important. It talks about the financial balance of ONAS itself. Current strategy is a wastewater sanitation strategy that will be implemented from 2020. Means the purpose is to go towards a heritage management plan as it is set in the hydraulic or water system or the water area. ONAS in the near future is supposed to have or to become a heritage management. The idea is to have the delegation of public service to a company that will be in charge of managing water and sanitation operation. So that means the gain made in the water sector will be also help balance, the lack of gain in the sanitation sector. We need a company that will manage water and sanitation at the same time. If it's not possible, that will be separated. But anyway, this is the roadmap of Senegal. We are going forward and heritage management company so as to relieve on us for its operation cost, but also be able to develop public-private partnership as it has been achieved in the water sector, be it in the urban water supply or rural water supply. We have this delegation of the service where we'll have a government heritage body in charge of operation and a private company delegated in charge of operation and maintenance of the facilities and also the management of those. This we succeeded in the urban and rural water supply area. I think it should not be an issue to duplicate this model in the urban sanitation sector. Thank you very much for your question.
Thank you, Monsieur Mouhamadou Gueye. I'm going to turn it over to, I know we're at time, but Engineer Satter, can you respond to the one question? And then we'll ask our kind of final reflection. So we'll go probably a couple minutes over. If you can respond quickly to the one question. Over to you,
one question regarding the nature-based solution. Actually, nature-based solution, it is a low carbon solution and low OPEX. That is why it is acceptable in most of the cases, but it has a disadvantage that it requires more land. So it will not be appropriate in every cases. In Dhaka, we are trying different technologies and different different modalities, and this nature-based solution is suitable for universities where there are lands, in the parks, or in big industries, and like this type of place where it is suitable, because it has other benefits. But all the buildings where densely building is situated, it is not suitable at all. Thank you.
Thank you so much. Thank you. Sorry, we are short on time for Q&A, but there were some other good questions. I know Lungi put some information into the chat. So I'm going to turn it over. We'll give you 1 minute. Francis will be doing our closing, the regional WASH advisor from UNICEF South Asia. So over to you, Francis.
Hi, Laura. On behalf of Frank, I'm here, Surendra Babu. Do you hear me right?
Great. Yes, we hear you. Great.
Okay, good. Thank you, colleagues. My name is Surendra Babu. I'm speaking from Kathmandu, Nepal, on behalf of our regional advisor of UNICEF for regional office. So as you can see in the slide, there are a couple of points that I definitely would like to touch upon. But before going to that, I would like to thank you everyone for putting this effort together for this great webinar. In fact, not this webinar, but also a series of webinars that exactly after 1 year of this Kathmandu event of this global summit on sanitation. So it is not about the talk that we did in the last year and throughout the year, but also the actions that have been taken by countries and which are already demonstrated by our colleagues from Senegal and Bangladesh in today's presentation. So with that thanking note, so let me start by talking a couple of takeaway messages that has come throughout the discussion, and also which could be some from my side as well, because as we reflect on what is working, I think it is also important to ask ourselves how we have to go further, maybe in a better way, maybe in a faster way or a smarter way, or how we can go together. So around those areas, you can see in the slide there are 4 points here. The first is about people. So it's not about only infrastructures, it is about people. So it's moving away from an isolated or infrastructure focused projects to a more comprehensive, especially as we are talking about sanitation in urban areas. So what would be those comprehensive approaches would be? So this is the first takeaway message that we derive, and then maybe hope everyone would ponder into it, because there's a lot of cases around city-wide solutions or integrated solutions are discussed, and is not only serving some people in urban areas, but of everyone. So this is the first one. Okay. The second one is about how we define sanitation. Definitely we define sanitation as a public good. So what does it mean? So maybe we need to make it more simpler, and just like a clean air or a safe road, that means the government must lead. So this is about leadership, and it is about having that clarity. So it's about the sanitation as a public good. So maybe we need to work more, or maybe discuss more on who is responsible for what, especially in urban areas, because no one single organization can, or organization or entity or institutions can do everything. So this is about defining the good and taking leadership by the government and defining clearly the roles of different actors. The third one is about coordination amongst actors, and at the same time accountability, especially talking about people who are marginalized, because to meet the need of the marginalized people, we should not be in fact these people should not be afterthought. They must be at our starting point. This is what we call focusing on the marginalized and the whole spirit of this inclusion agenda currently. So that's why we say the coordination is not just an act, it's not a luxury, rather a necessity. And it also must be clear that quality sanitation is a right. It is not a privilege, because then if we understand that way, maybe we can address the need of different people, especially the marginalized population in the urban areas. Talking about the fourth point here in the slide is about the skilled workforce. So as we are trying to build capacity in various fronts, but also at the same time, we need to train professionals at every link of the service chain and also the sanitation worker, because sanitation workers are not invisible. In fact, they are essential, and how we build capacity of these people also. So talking about the key, let's say, takeaway messages, especially hearing you, the presentation, also the ongoing discussions in the recent past, those are the fourth point that I would like to share with you all. I hope you'll all agree, and then maybe you find a space for everyone in the call and every agency to put your thought and your resources and your effort into it. So can you do the next one? Next slide. Colleagues, as you know, there are a couple of webinars that already we delivered. In fact, today we completed the fifth one, the scaling of service delivery in urban settings, and remaining one is the human resource capacity. I think though the date is to be decided, but tentatively it is already planned. So look forward to meet many of you in that webinar as well, and have a champion on leading this agenda of safely managed sanitation. So it is what I want to say on behalf of Francis and on behalf of UNICEF Regional Office from Kathmandu. Thank you, and over to you, Laura.
Thank you so much, Surendra. And with that, we will close our session. I'm sorry that we did run short for the discussion, but there were some really great comments. And thank you for the extra time. With that, we'll close the webinar. Thank you all.